Hello friends, welcome to my channel. This is one of the important videos for patient information. You can find these videos and other videos in my list of knee replacement patient information video series. In this video I am discussing about your preparation for your knee replacement surgery when your surgery is scheduled in next 1 week to 10 days. Let's say your surgery is for 10 days from now, how you are going to prepare with regard to your medicines and what you are going to do at your home. First thing, we will talk about medicines. Many of you are having diabetes and you are on medicines. My suggestion is to take these medicines very punctually and make sure your blood sugar values are very much controlled and you are maintaining your HbA1c values. This helps in avoiding any infection and preventing any complications during surgery. Properly check your blood pressures, maintain the record of your blood pressures and diabetes, and if you are on blood thinners, you should stop 3 to 4 days before surgery because these blood thinners will interfere in clotting mechanism and there might be increase in bleeding during the surgery. In order to avoid this, blood thinners are to be avoided. Antiplatelet drugs like a clopidogrel or these medicines are to be avoided at least 4 days before your scheduled knee replacement surgery. Instead of Ecosprin 150, you can switch to Ecosprin 75 during this intermediate time when you are waiting for your surgery. And post surgery, anyways, blood thinners will be started on the day of surgery. If you are on antidepressants, you have to check with your doctor and you should also stop it because some of these medicines interfere with the bleeding and clotting mechanism. If you are on DMARDs, means you are on steroids and disease modifying anti-rheumatic drugs for the rheumatoid arthritis, you can continue those medicines. Especially if you are on steroids, you can continue those medicines, but you please discuss with your physician and anesthetist when you meet him 1 week before surgery because sometimes these steroid medicines have to be continued and dose titration they will do. But other than steroids, other medicines are to be stopped 2-3 days before your surgery. If you are consuming alcohol on a daily basis, my suggestion is to avoid it completely during this period because this will cause dehydration and fatigue and wound healing problems during the surgery and during the post-surgery period. So you have to prepare to stop this alcohol for 1 week to 10 days and post-surgery at least 3 to 4 weeks. Preparation at home. So what you are going to do at your home when you are waiting for your knee replacement surgery. First thing, clear the path where you are going to walk, make it wider because you will be walking with a walker for first 2 to 3 weeks, and identify caretaker who will be with you all the times and what are the things required for you. You can explain them and try to keep the things at reach and lower level rather than in the higher position so that you can take the things which are needed immediately whenever it is required. Fix your commode rise. This you can fix it before you get admitted to the hospital because after you come back you will be immediately using that. Then keep comfortable clothing, loose fitting cloths rather than tight dresses so that you can wear it easily without any support. You can because initially first few days you may not be going anyways out of the home for 10 to 15 days. So comfortable clothing and extra pillows because whenever you are lying down, whenever you are sitting, keep the leg on the pillow so that the leg is in little elevated position that prevents swelling formation. Keep ice packs at your reach because for the pain management initial days, ice packs are very much helpful. So during these times, avoid any cuts, abrasions on the skins, and you should avoid any dental procedures at least 15 days before at least 15 days to 1 month before your planned knee replacement because during the dental procedures or any of such procedures, the bacteria might come in the blood circulation. The possibility of infection to the processes is very much. You should avoid any cuts and bruises and any abrasions, because these small cut wounds or bruises or abrasions might cause an infection, and this infection might get spread to the processes in the initial period. Initial 15 days is the time which should be very important for the setting of that processes and body adjustment mechanism for this processes. So initial 15 days to 20 days is the time should avoid infection at any cost. And any urinary infections, if you have any burning urination or anything, treat it, and you should discuss with your physician to confirm that it is not a urinary infection. I think I have covered most of the common issues. All the best for your procedure, and like my video if you liked it. Please share to your family and friends. Don't forget to subscribe to my channel. There are so many informative videos in my channel regarding knee and hip replacements and sports related arthroscopy and shoulder surgeries. Thank you.